My name is Adam, and I live in South Orange, New Jersey. I am, yes, I'm vaccinated.
Great. Let's do that one more time. If you could just say, I am currently vaccinated.
I am currently vaccinated, yes. I came to the decision to get vaccinated because my best friend since middle school, he died of COVID back in the early days of the pandemic. He was 24, and I did it for him. I did it for myself to be safer. And personally, I feel as if I have an obligation and a responsibility to my fellow community members and to the people I love and care about, just to keep them as safe as possible. And I was excited to get vaccinated. I am currently vaccinated, yes. I decided to get vaccinated because my best friend since middle school, he died of COVID-19 back during the early days of the pandemic. So I did it for him, I did it for myself to be safer. And personally, I feel as if though I have an obligation and responsibility to keep my fellow community members safe and to a responsibility to the people I love and care about as well. We keep us safe and, it matters to like prioritize our own health and the health of those around us. The experience for me getting vaccinated was pretty easy, pretty simple. New Jersey was operating on like a tier system, so I believe the first people who were getting the vaccines were like seniors and people who were immunocompromised. When it was started to be opening up to healthcare professionals and to the general population, I was able to schedule an appointment at a vaccine mega site. There was a very long line there, but it was like pretty quick, pretty fast. I was in and out of there maybe like 15, 20 minutes tops, and the whole experience was pretty like non-stressful for me, pretty calming, and I was pretty happy about it all.
Would you consider yourself like an advocate for vaccination in sense of like friends who are on the fence? Like, were you trying to talk them into getting vaccinated?
Oh yes, definitely. I consider myself an advocate to getting for people to receiving the vaccine. It's actually funny. I actually convinced a couple of my friends and a couple of my housemates to get the vaccination. I had one housemate who was like concerned about possible side effects, if there's any like long-term effects, and I explained to her what I knew of the vaccine, and I pointed her to a couple of resources as well on the CDC website, the New Jersey Department of Health website, a couple of news sources as well, ranging from NPR into the New York Times. So I actually helped link people, at least a couple of people, to the vaccine because it's important that we just all keep safe and just think about what we owe to each other in a way. I believe the COVID vaccine is readily available in the state of New Jersey for all community members. I think for me, what I've noticed is like since the vaccine has started to become more available, we're not seeing as many like vaccine like mega sites or like pop-up clinics. So generally speaking, a way to get like the go-to way to get a vaccine is like schedule an appointment through your doctor, through a pharmacy. And I think people can find that maybe a bit challenging or a bit hard if they don't have like any Wi-Fi, if they have like Wi-Fi connectivity issues, if they're not sure how to schedule an appointment, if there's any language barriers. So personally, I would like to see like more of those open vaccine clinics again because I think it just made the whole process a lot easier and a lot more open to the general population. I would say yes and no, in that yes, is that it's readily available. It's general pharmacies and doctors do provide the vaccine. I would say no in the sense that maybe some people don't know how to go about scheduling an appointment or how if they have like any Wi-Fi barriers or like Wi-Fi connectivity issues. So the availability is there, but in terms of access, it can be a little maybe challenging for some people who may not be as tech savvy, who might be shy as well as scheduling an appointment, or who might have a language barrier or like any cultural barriers too. So I think those kinds of gaps should be bridged to enable like more of an equitable vaccine distribution for all communities. I think what the state can do to help mitigate those problems is to ensure that all vaccine information, related information, is available in multiple languages. Spanish, Arabic, Hindi, Urdu, Tagalog, really any and all languages that are spoken in the state of New Jersey. I think it's also expanding the definition of like what does being vaccinated mean, because I think when we hear the term fully vaccinated, we think just the two-dose regimen. But fully vaccinated should also include like people who have received the first two doses but have also received the boosters. I think that gets a little bit lost in the conversation. I think the state can also have like maybe like Q&A sessions that are available in both like various town halls across the state, as well as in opening those town hall sessions up in a virtual setting as well, maybe through like a Google Meet or like a Zoom setting. Um, as well, I'm also open to the state having like vaccine mandates. I think that could be very impactful and very helpful, and I think that could help like communities feel safer as well, like going in any indoor spaces. For organizations, um, for nonprofits and private businesses, it could look like having like a vaccine mandate to like shop in an area, or like go to a concert venue, go into a bar or to a club. For nonprofits, it could be um, sponsoring like healthcare professionals or like experts to like talk to come talk about the vaccine, offering free vaccines, and I think that's also something very important too. I think people are concerned about any cost to the vaccine or anything related to COVID-19. Um, so what the state and like any partner organizations can for sure do is like guarantee that any and all vaccines, any boosters are going to be free for any person. That testing is going to be free. That treatments are going to be free. We live in a healthcare system that is unfortunately for profit, and I think with COVID-19, I think we should take maybe the opportunity to like move past that for-profit motive and really just have a free and equitable like healthcare system for all people. Personally, I haven't talked to my own healthcare provider when I was getting the COVID vaccine. When I first got the vaccine, I got it through a vaccine mega site. I think any and all conversations I had about the vaccine, I had it with like pharmacists who were administering like the booster to me. Um, though personally, I didn't have that conversation with the doctor. I knew the vaccine was safe though, just from looking at the CDC website, looking through various like news organizations and their interviews with like doctors and experts. No, I'd never really had that conversation with my own healthcare provider. For the resources that I relied on and trusted, I looked at the CDC website. I looked at the World Health Organization's website as well. I was looking at the New Jersey Department of Health's website for any like updates or for like any information regarding the vaccine or any COVID-19 updates. I was also looking at like various news agencies and sources like the New York Times and NPR, any interviews that they were doing with their like experts or like doctors, because I wanted to make sure that everything was like data driven, scientifically backed, and from what I saw and from how everything was being interpreted, um, I felt and trusted the vaccines were both safe and effective, and I rushed getting them. I don't think all communities have been given equal access to the COVID vaccine. I was reading a study, and unfortunately, I can't quote the full name of it or the title of it, but it was looking at like looking at various communities throughout the country and their vaccine uptake, and there was two communities that really were falling down the wayside in terms of like receiving the vaccination. It was people who identified as conservatives or Republicans, and the second group were people who were uninsured and underinsured. And for the latter group, it was generally thought that people who are uninsured or underinsured would think that there would be a cost to the vaccine, cost going to like any facility. And people worry about like surprise medical bills. People worry about costs, especially when people are struggling to pay bills. And I think what can really be helpful in like ensuring like equal access for that community is ensuring that the vaccines are free, having that information out there, having that information out there in various like mediums, in person, online, through public adverts, on like public transit stations, and through in different languages as well. I think that's one way to like bridge the gap and like just to ensure that all that vaccine information that we have, that the vaccine is safe, that it's effective, that it will protect yourself and your communities. I think that can go a long way in like getting a person to receiving the vaccine and promising, ensuring that this vaccine that you will get will be free. And for some reason, if a site does have a cost or a vaccine does have a cost, like making sure that information is available to that person and saying, okay, this place will charge you. This is how much they'll charge you. If you want to go to a free location or to a lower cost location, here's where to go to. And just making it easier for people to like just find these resources and these locations out. Something I would share about the COVID vaccine and like the COVID pandemic in general is The pandemic is still ongoing. We still see people die from COVID-19 every day, and it's a preventable infection by keeping yourself fully vaccinated, which includes getting boosted, keeping yourself masked when you're going to indoor places, maintaining social distancing when you can, because at the end of the day, we keep us safe. And it's important from like an interpersonal level, and also to from a policy level to maybe reach out to community leaders, reach out to political representatives, and say, listen, these vaccines, these treatments, these tests, these need to all be free. These all need to be equitable. We need to have resources in different language and different mediums so people can have this information. And maybe being open to vaccine mandates for people of all ages to ensure that we're getting a handle of this pandemic so we can prevent needless death from happening.